My children are going to ask me, so you knew all of these stats, yet you haven't done anything about it.
Race to Feed the World, premiering 31st of May, Monday on CNA.
This is Asia Now.
Hello there, it's 5 p.m. in Singapore and Hong Kong, 2:30 in New Delhi and 4 o'clock in Jakarta. I'm Otelli Edwards. At this hour, a defiant message from Myanmar's ousted leader Aung San Suu Kyi. She says her NLD party will exist as long as the people exist, in her first comments since the military coup. Taiwan plans to extend its coronavirus alert as cases continue to increase. It's also facing growing pressure to accept vaccines from China. And Japan opens its first COVID-19 mass vaccination centers to speed up rollout. It's grappling with a virus surge just 2 months before the Tokyo Games. Myanmar's detained leader Aung San Suu Kyi says her party will exist as long as the people exist. It's her first public comment since her arrest nearly 4 months ago. Her defiant message comes as the army-led electoral body is planning to dissolve the National League for Democracy. Ms. Suu Kyi made the remarks during her first in-person court hearing in Naypyidaw. The lawyers say she is in good health after having a face-to-face meeting with her for the first time since her arrest. The detained leader is facing 6 criminal charges. Included are sedition, illegally owning walkie-talkies, and breaching the country's Official Secrets Act. At the same time, violence continues to escalate between the military and anti-coup fighters. At least 4 people have reportedly been killed. 5 more were injured after security forces fired heavy weapons at a church and village in Kaya State. Clashes also erupted along the same region just hours before. About 40 soldiers were reportedly killed. Civilian forces have allegedly been using weapons from air guns to homemade bombs to counter the army. Violence also broke out near the border with China. The People's Defense Force, a coalition of local militia, overran a police station in the southern Shan state. Around 13 members of the army were killed during the raid. The group also claims they managed to capture at least 4 police officers. They warn they will continue to fight the regime. Elsewhere, Taiwan is planning to extend its COVID-19 alert that's due to expire at the end of the week. The island is now at the second highest alert level, while despite tighter social restrictions, cases have continued to rise. Taiwan has added 590 new infections today, including a backlog of 256 cases. Authorities have been adjusting the tally due to delays in testing and reporting over the past week. Residents are worried about the large numbers. The health minister says infections have peaked last Monday and should continue to decline. Meanwhile, Taipei has completely banned dining in from today to curb a rising positivity rate. Taiwan's government is also facing growing pressure to accept vaccines from China. Opposition lawmakers say people's lives are at stake and that the real enemy is the virus, not the mainland. The island has inoculated just 1% of its population. It has relied on AstraZeneca's shots, but the doses are running out rapidly. Japan has opened its first mass vaccination centers in a bid to boost a sluggish coronavirus inoculation drive. The country is battling an infection surge just 2 months before the Tokyo Olympics. The 2 military-run centers in Tokyo and Osaka will administer thousands of shots daily.
Doctors in Japan's second-largest city say they're struggling to cope with an influx of COVID-19 patients. Hospitals in Osaka are running out of beds and ventilators, as exhausted medical teams warn of a system collapse. The city is bearing the brunt of Japan's 4th wave, accounting for a third of the nation's death toll in May. Just 14% of the prefecture's COVID-19 patients have been hospitalised, leaving the majority to fend for themselves. Doctors are now warning of an impending disaster if the Olympic Games go ahead in July. Japan has one of the lowest vaccination rates of any major developed nation. Only about half of the country's medical staff have completed inoculations. Caring for critically ill patients in the face of infection risk has taken a serious toll on staff. Some have been doing hundreds of hours of overtime for a year. Japan's surge in COVID cases is being driven in part by the UK variant of the virus, which is considerably more infectious. In the week leading up to Thursday, there were some 3,900 reported new infections. That represents a more than five-fold jump over the corresponding period 3 months ago. Much of Japan, including Tokyo, is under a state of emergency, which is expected to be extended to June. On Monday, Japan opened its first major inoculation centres in Tokyo and Osaka, as it races to vaccinate most of its elderly population before the start of the Olympics.
オリンピック開催までに8割か9割ぐらいやっとけばスムーズにオリンピックできると思うんですよ。で、いろんな社会生活と経済の影響がだんだん早く政策的に早くやっておいた方が安心できるわけですよ。で、そういうところの行政のね、いつもだけどそういうなんていうか後手後手というかね、で戦略的にできないのかなっては思いますね。
Malaysia has reported 6,509 new COVID-19 cases. It's a slight dip from yesterday's highest daily jump in infections at nearly 7,000. Well, the country's total tally now stands at more than 518,000. The state of Selangor remains the hardest hit, followed by Sarawak, Kuala Lumpur and Johor. The country is battling another resurgence of cases with record number of casualties in recent days. In the latest move to curb the spread of the virus, Malaysia has introduced stricter measures instead of implementing a full lockdown like last year. Starting tomorrow, 80% of the country's public service staff and 40% of people in the private sector must work from home. This will affect about 8 million workers in the country. High-risk places will be shut immediately, and usage of public transportation will be limited to 50% capacity. Shoppers can only spend a maximum of 2 hours in retail premises, including shopping malls. Prime Minister Muhyiddin Yassin earlier said that the government decided not to impose a complete lockdown because it's trying to strike a balance between protecting lives and livelihoods. Australia's Victoria state has reported 4 new COVID-19 infections, all in the city of Melbourne. This is the state's first cases of community transmission in nearly 3 months. The new infections have sparked a search for the source of the outbreak. Well, authorities were alerted to the unfolding cluster after a man tested positive for the virus after developing symptoms last week. Victoria's chief health officer says the man is carrying a high viral load and is likely to be quite infectious. A woman and a preschool child living with him have since tested positive. A male relative from a separate household has also tested positive. Other family members among the 2 households are in isolation and have so far tested negative.
We all have our role to play here, and we all need to step up and do what we can to keep ourselves safe, our families safe and our community safe, particularly as we enter the high-risk period of winter. This is not a time to be complacent.
Well, contact tracers are investigating a potential link between the new cases and one identified earlier this month with links to a quarantine hotel.
Given the proximity of the gentleman from early May who returned from hotel quarantine in Adelaide, who lives in that city, we don't rule out the prospect that there is a link. The dates don't line up immediately, so we can't rule out that there's a missing link out there.
Singapore's Changi Airport will designate areas where arriving passengers come into contact with staff as zones that require the highest level of protection for workers. It's rolling out a new zoning concept based on risk exposure, with the airport now the country's largest community cluster. Additionally, passengers from the highest risk countries will be served from a dedicated facility in Terminal 2, where operations are currently suspended. In arrival areas, all staff, including security personnel, will wear a full set of personal protective equipment. They'll also be given their own areas to rest and eat. The airport is looking to deploy fully vaccinated staff here, as well as younger workers. It's also working towards daily rapid non-invasive testing of staff in this zone. Portable air purifiers are also installed at key areas, on top of existing systems that allow a complete change of air every 6 to 10 minutes in